So tell me, when and where did you start your social work practice?
That was in New Brunswick, probably around 1970. I had a BSW, and then I subsequently went to the University of Alberta in Calgary and picked my master's up there. So I began practicing really in Ottawa in about 1974.
And what drew you to the profession?
That's a very interesting question because you can reflect on maybe a variety of influences, but at the time when I graduated from Cinevex, so I'm a maritimer, and I have been involved in a variety of outreach programs at Cinevex. And in the summers I worked at a correctional summer camp for juveniles, and I think both of those had a decided influence in terms of my choice of social work. Because the field of practice that I went into in the beginning was young persons, and then subsequently I worked with seniors.
So what would you say was your primary area of practice then?
I would say that I was more of a clinician than not, even though I very well may have been involved in terms of administration. I would say it was a combination, but I don't think I never was a clinical social worker.
What would you say it was like to practice in the years before that professionalization?
It's a very interesting question because I'm not sure that I can answer that. I was probably just coming into the profession at a time when the college was the first version of the college was established. And so I really couldn't kind of answer the question in terms of what was it like beforehand, because I was a member of the college fairly early on.
Is there a social work contribution or accomplishment you're particularly proud of?
I guess I would say that I've been fairly involved with the association, both at the branch level, at the provincial level, and to some extent at the national level. And when I think in terms of the Eastern Branch, I've been involved in a variety of things that I think are kind of interesting. One was I was the president for a period of time, I think on 2 terms. But during the initial term, we established an office, which seems like, we take it for granted today, but at that time it was a big step. Secondly, I was involved with regard to a variety of initiatives that would have been more or less described as recognition. So Eastern Branch, before there was a social work week, we established for Eastern Ontario a social work day. So it wasn't me, it was the board that I was involved in. And in speaking to the people at the national office saying, hey, we like that idea, because obviously the national office being here, there was a lot of interaction between the national office and ourselves. And so I was involved in the establishment of Social Work Week nationally. Secondly, in terms of the establishment of awards, both in terms of the Tusell Award and really the educational, either bursaries or scholarships, I was very much involved in that. And when you think today that if you go across the provinces, you go even nationally, Eastern Branch is almost quite exceptional. It has, both in terms of the media awards, because I was involved in that as well, and in the recognition of individuals, and then with respect to education, there's some of these things have been kind of picked up on, but on the area of education, we probably are one of the leading, not only branches, but associations in the country in terms of the size of the cumulatively of the awards. So I would say those kind of contributions, I think, really are quite significant.
Given what you now know, is there anything you'd do differently in your career if you could go back?
Oh, probably not. In terms of careers, it really is, I think the reality is that the opportunities that arise at any moment in time, whether or not you take those opportunities or not. Some of those, for instance, you apply for a job, who knows whether you're going to get a job or not, that particular job. My moving from youth to seniors wasn't really that much of a leap, because I have been involved with, really, as I mentioned before, when I was doing my undergraduate degree, I was involved in residential work. So when I came to Ottawa, I was involved in residential care for children and youth. So then my move to seniors was also in terms of long-term care facilities. So in all of that, I really was involved, in essence, in terms of the same kind of work. So I wouldn't kind of say it's, there would have been things that I would have done differently, because there was that kind of continuity in terms of the work that I did. And I would consider myself extremely fortunate to kind of, in essence, not really have very many changes in my work career.
What were some of the challenges or barriers you worked to overcome? And did you have any allies?
I think both in terms of myself and really the colleagues that I worked with, I would say that as a profession, we don't really do a very good job in when students are really being oriented to the profession, they really do not kind of get a clear enough grasp of the differences that different schools of social work may emphasize. As a consequence, when they begin working with colleagues, they may very well be speaking a different language or have a different orientation, and that kind of, in the first instance, weakens our own ability to communicate with ourselves. Secondly, and I don't know whether I would call it a problem in relationship to the schools, but certainly it's a problem in relationship to the profession, that people who practice do not really come to the profession with a strong enough kind of sense of what is the kind of perspective that because I essentially practice in health. So we're really looking at people who are in other professions who you're working with in teams. And as much as that's the case, you don't really have a clear enough kind of sense of the orientation or theoretical orientation that they may have. Not having that puts you in a position where it's difficult to kind of find language that easily bridges. And so both in terms of within the profession and the ability to communicate across professions, I don't think that we do a good enough, we probably don't pay enough attention to its importance, because if we don't have the ability to kind of easily understand other people in terms of the perspective that they bring, then I think you struggle to kind of have a credibility about the skills that you're hoping and the outcomes you're hoping to be able to achieve. So that's a barrier, and I think that it's surprising, it really is surprising that a profession who would claim that its primary skill is in the area of communication doesn't kind of recognize even within ourselves. So you have somebody coming, let's say, theoretically from Carleton, who would have a structural kind of a orientation and match that against someone from Waterloo or someone from McGill, and you'd be kind of saying, they're not talking the same language at all. And you say, why? And it's perfectly fine, but it's that one can have different orientation, but the ability to be able to kind of take your orientation and kind of translate that into someone else's language and say, hey, but there's the commonality, is rather important. And for young people who are graduating, I don't think they just encounter a difference.
So what words of wisdom would you like to share with today's social workers?
Again, I think one of the key things is you're bringing a set of skills that is more, if you're a generalist, is fairly transferable from one setting to another. The profession kind of, both in terms of at the bachelor level and at the master's level, seeks to turn out individuals who are journalists who are also specialized in areas. The ability to be specialized in an area of practice is pretty critical for us because the knowledge base that is needed is not singularly just at a journalist level. However, beyond that, I think that one of the things that seems to be happening is if you focus too much on being a journalist, a specialist, you lose perspective in terms of where the profession is at. And I do see an important role that branches can play with respect to being able to bridge between individuals who are either at a bachelor level or a master's level, coming from different kind of orientations of theoretical orientations of practice, but being able to kind of see the commonality that kind of connects all of us as individuals who are in this profession. Given that, I would say a key piece of insight I would want to kind of convey to people coming into the field would be it's critical that you remain involved with your professional association throughout the time that you are in practice. You know, I've really had some very interesting kind of opportunities, but one of the more interesting ones, I think, is having worked with people who have been retired and who have maintained an active role in the profession. So you say to yourself, well, why would they do that? Why would they do that for 20 years after they no longer are working? And it was always for me both a motivator to kind of see people who aren't doing this because it's work. I mean, the profession isn't just quotes work. And for me, it was the most obvious that these people, and I can reflect on some of the key people during the period of time that I was involved in the branch who were in leadership roles, and surprisingly, they came out of principally the Children's Aid Society, which for a day you'd say, hey, this is indeed surprising because we don't have that very many members who are members who work at the Children's Aid, who are members of the association. But I would reflect on Ruth Brown, Joyce Turnbull, Joyce Ireland, and others who I think who are working well beyond their years were Carl Burchard, Charlotte Burchard. These people really made a significant impact in terms of during the period of time that they were practitioners, but as I said before, well beyond that time.